tell you about cataract surgery and refractive lens exchange. So it's an operation, usually done as a day case, under local topical anaesthetic. I numb my eyes up with just drops, and then you look into a bright light for me, 5, 6, 7 minute job. The bright light is quite tricky to look at, but it does get easier. You are covered up with a little drape, and the drape, particularly if you're claustrophobic, it's not very nice, but it's only 5 or 10 minutes you've got to have it on it. It does lay over, it sort of sticks to the eye that we're operating on, and then we lift it up off you. But it is a little bit claustrophobic. You hear some funny noises. We'll keep on asking you to look into those bright lights, and it is really bright, but it will get easier and easier. Sometimes when we inject local anaesthetic into the eye, you can feel a bit of an ache, but it's not supposed to be painful. If people do struggle, then we can actually give them a little injection on the operating table to stop the eye moving. Again, all of this sounds ghastly, but it's really not as bad as it sounds. It's a day case, so you're in and out the same day, usually in hospital for a couple of hours or so. You have a clear shield on afterwards, and that clear shield is taken off the next day, and then you use drops for us. Typically a steroid drop and an antibiotic drop. Steroid drop to stop the inflammation inside the eye because the eye becomes inflamed, and the antibiotic drop as a belt and britches thing to stop infection inside the eye, because that is one of the most catastrophic complications we can get. So it's a simple, straightforward operation, most commonly carried out procedure on the NHS and the safest procedure you can have, but not risk-free. And the problem is it's your vision, and that is very, very important. So it's really important you know that complications can ensue. You're nervous about it, of course you're nervous about it, it's eye surgery, but you know, we ride you through, and you know, you grin and bear it for a few minutes, and most people can tolerate it. You can get your hand holder as well if you need to. We're playing music often, and you know, so it's not as bad as it sounds, so please try not to worry about it.